Hello everybody, this is Dr. Gita Mathai and this is my Health Vibes channel. Today we are going to talk about stones. When we think of stones, we think of the garden, we think of houses, but there are stones which can form in our body in many sites. Everybody has heard of kidney stones and gallbladder stones, but did you know that stones can also form in your mouth? Now if you open your mouth on either side, there are a pair of tonsils. Sometimes stones can form in these tonsils. They look like little white pebbles and they are painless. And they really do not cause any trouble except that they may prick when you eat and they may cause bad breath. And when you swallow, you might feel they are uncomfortable. The way to remove these stones is to take a bud and press. The stones should come out. But if you gag when you press like that, then you need to go to an ENT doctor who will remove these stones. To prevent stones from forming like this, you need to wash out your mouth and gargle with a little bit of warm water and salt at least once a day. These type of stones are more likely to form in people who smoke, who are malnourished and who are dehydrated. So you need to guard against all these things. In the mouth, we have 3 salivary glands and they have tubes through which the saliva goes into the mouth and helps in the moistening of the mouth and digestion of food. These glands can also become blocked with stones. Calcium can deposit and then the gland gets blocked. So what happens is that when we eat food, the gland tries to secrete saliva, swells up and becomes painful. After some time, even when you think of food, the gland may swell up and become painful. If you put your finger into the mouth, you can feel the stone, and by massaging gently, it is possible to take it out. If it doesn't come out because it is large or irregular in shape, then you need to go to a doctor who will remove the stone for you. The other places that stones form are in the kidney. Everybody's heard of kidney stones. Kidney stones are of 2 types. If they are calcium stones, they can be picked up on X-ray. But if they are uric acid stones, they cannot be seen on X-rays. And you need an ultrasound scan or a CT scan to find out that there is a stone. Kidney stones may be single or multiple. If they are less than 3 mm in size, usually they cause no symptoms and they do not really require treatment. Once they become large, they can obstruct parts of the kidney and prevent the urine from draining freely from these areas. This can cause pain, fever, and infection in the urine. It causes chills, pain in the abdomen, and pain in the back. The kidney stone, if it remains in the kidney, quite often may be asymptomatic, but it does not do that. It may move and try to move and come out of the body. The pipe which leads from the kidney to the urinary bladder is a bit small, so the stone gets stuck in that pipe. In that case, a back pressure of urine builds up behind the stone, the kidney swells up and there is acute pain and fever and chills. The urine also may become high colored and even frankly blood stained. Once the stone moves into the bladder, because the bladder is large, it can stay there comfortably and be picked up accidentally on X-ray or ultrasound. Kidney stones can be prevented if you drink 3 to 4 liters of water per day. In summer, or if you work in an area where you sweat a lot, you may need to drink more water. Also, do not take a lot of vitamin C and try to keep yourself well hydrated always. Do not hold your urine. Always pass urine when you feel like passing. The other place which is very common for stones is the gallbladder. This is a small sac-like thing which sits under the liver. Bile collects in it. Bile is necessary for digestion, and bile contains cholesterol and bile pigments formed by the breaking down of the red blood cells. If the pigment is formed in excess, stones may form. If cholesterol is excreted by the liver in excess, stones may form. Cholesterol can be excreted in excess by the kidneys even if your blood cholesterol is not high. Stones in the gallbladder also may be single or multiple. They may be a single large stone and it can grow to the size of a ping pong ball without any symptoms at all, or there may be many little stones. The stones can go back into the bile duct and get stuck there. The bile duct swells up. They can cause fever, bacteria can settle there, they can cause chills and they can cause pain. Gallbladder pain is not necessarily in the abdomen, it can even be in the right shoulder. Once gallstones have been found, if they're asymptomatic, there is no need to treat them. But if there are symptoms, the gallbladder has to be removed. Unlike kidney stones, where the stones can be removed, in the case of gallstones, the entire gallbladder has to be removed, either with open surgery or laparoscopy. To prevent stones forming from anywhere in your body, take plenty of fluids, do not smoke, gargle at least once a day, stay hydrated, and maintain an ideal body weight so that these problems do not occur. This is Dr. Gita Mathai signing off. If you liked what you heard, please subscribe to my Health Vibes channel and press the bell button. The same content is available in Tamil. Thank you.